Mobile clinics are hospital on wheels. For example, for us at Zuri Health, we designed a hospital on wheel that, has a huge, bus that has, multiple things like a lab, X-ray unit, dental. So we take a level 2 hospital and in some cases level 3 hospital to underserved communities. And it's designed in a way that it has its own power. It's designed, it has its own water filtration system and it's able to provide support.
You're sick probably because you don't have access and you cannot afford those two things, cost and availability. So when that mobile clinic comes to you, it's coming with equipments probably that are not available. It's coming with medics. Remember in Kenya, we are saying only 16% of medics are in the rural areas.
Some people have never been touched by professionals in their lives.
Health camps are a poster child of inefficient healthcare services.
Technology also offers a gap. It fills that gap of continuity of care. After we leave you and we give a new medication, we can still follow you up.
And when you screen, what the data shows is that about 25-30% of those we screen have NCDs that they didn't know they had. Data has shown actually that in areas where we've had medical camps, that the economic spend in that area increases, right? Essentially, one of our partners that we've been doing medical camps with have seen that there is an increase in the usage of their products and spending, in that area after a medical camp. And what does that show? It shows that you cannot divorce the economy of a particular region or a place from the health situation in that area. Yeah. So essentially, when we intervene in underserved communities, there is a pickup of economic activities.
Welcome to the Med Squad podcast. My name is Yafesi Musoke. Now, when was the last time you ran into an old schoolmate? So you run into this guy and says, hey, it's been a long time, and you do all the banter. And then he says, look, we'll talk later because I have to head for a camp. And you look at him like, you're not in camping gear. What camp are you going for? He says, it's not that kind of camp. It's a medical camp. Well, I have my Med Squad with me and they're experts in these medical camps. So they'll introduce themselves from my left.
My name is Ikechukwu Anoke. I'm CEO at Zuri Health. Excited to be here again.
Mm-hmm. All right, my name is Dr. Kelechi Okoro, also known as the Health Entertainer. I am a public health advocate and experienced in grassroots interventions.
Thank you very much. This is Antony Ndegwa, a general practitioner, a medical. Please don't look at me.
I don't look at you.
Okay, let me take it again. So I'm Antony Ndegwa, general medical practitioner at Zuri Health, passionate about cardiovascular and chronic illnesses.
All right. Now, we'll just get straight into it. Why are you camping? What exactly is a medical camp? For us, we see vans that say free medical camp. And the picture we have in our heads is tents. And maybe people with cataracts coming to sit in a tent and wait to have their blood sugar. But by professional definition, what is a medical camp? And is it different from a mobile clinic?
Well, I would say that they're different. A medical camp is usually an outreach in maybe an underserved area where some special services are provided for people, either for free or at very discounted rates. Most times medical camps are sponsored. Mobile clinics are hospital on wheels. For example, for us at Zuri Health, we designed a hospital on wheel that, has a huge, bus that has, multiple things like a lab, X-ray unit, dental. So we take a level 2 hospital and in some cases level 3 hospital to underserved communities. And it's designed in a way that it has its own power. It's designed, it has its own water filtration system and it's able to provide support for that. So when you look at the medical camp and the mobile clinic and how we've integrated healthcare at Zuri Health, the mobile clinic helps grow the medical camp. So because when we, ideally before you see mostly tents, and the services they provide are basic. But now we're bringing a hospital to your location. So think of your X-ray unit, think of your dental, optical, all provided in an underserved community where there's probably no light, but the mobile clinic is able to power what happens within the environment.
Okay. Are these in place of the clinics in existence, or are you looking for areas that don't have any of these facilities?
Okay, first of all, for Nigerians watching, when you hear medical camps, it's just we're talking about medical outreaches, yes. And for me, it's like a pop-up shop, where you have, like Mr. Ike has explained, you have all of these facilities brought to you. And so what this is solving is access. You're bringing medical care, you're bringing good medical care to people who are in underserved communities where they do not have hospitals or they do not have good roads or transportation to get them to a nearby hospital. You're bringing, first-time diagnosis to people who have never seen a doctor, who have never seen the need to even see a doctor. So you're bringing health education, you're bringing immunization. For some children, they've never had a chance to get immunized. So the women bring them, and then in the course of checking their blood pressure, all of that, the children get immunization. You're also bringing health education, very important, because when they come, sometimes they come just for the incentives. They come that, we have doctors here, they're coming with jabs and vibes. But in the course of it, you're talking about health, there's health education, there's immunization, there's screening, basic screening. For the first time, a lot of people are getting their blood pressure checked, they're getting their blood sugar checked, they're getting tested for malaria and everything that is basic. And remember, the Wellness on Wheels is also the hospital on wheels is also there. So beyond the basics, they're also getting, sophisticated, treatment or interventions that the mobile clinic has to offer.
Yeah.
Yeah.
So what are the most common conditions that you tend to treat in mobile camps? You might have all these facilities, but there's probably a limit to what you can actually treat.
Yes, that is true. However, when you're preparing a medical camp or probably a mobile clinic is tailored towards what or data shows in terms of the locations you're going. So you have to do some background research and identify that this area or this geographical location is prevalent or with specific diseases, such that you're able to prepare in terms of what test to offer, what medications you should carry with you, and what speciality of doctors you need to go with. So you cannot go to an area prone with maybe, let's say, long-term chronic illnesses, and you go there with infectious setup. So it is something, there is some background homework you do before you go. So that is identified from the previous data you have from local hospitals and also local personnel, medical personnel around there.
Are there common ones that you can encounter across the board?
So for example, in Kenya, you're looking at the rise of chronic conditions. So you have to think about that. But that is dependent on the location. However, you're thinking maternal health, women health. Everywhere there is a woman, probably you need women health, right? And children. So there are these services that cut across all the geographical location because we have this kind of people. Okay. So women health, child health, screening for infectious diseases like HIV, communicable diseases like HIV, pneumonias, and then chronic conditions like hypertension, diabetes. We offer these. Those are basics. And then now we have specialized care, for example, eye, dental, and people that need even mental health. So we offer those kind of services.
Okay, let's talk about the impact of these camps. Like from experience, what impact have you seen? Because these areas, as you mentioned, are underserved.
Well, you see, one of the challenges around healthcare in Africa is just important to understand. For example, half the continent live on less than $1 a day, extreme poverty. You have the doctor to patient ratio, 1 doctor to 10,000 people. Now, hospitals infrastructure that allows for access to health isn't there. And we're very poor. So it's important to look at that. The basis of the screening is preventative healthcare. Because if we want to look at how to tackle progressively healthcare issues on the continent, screening is important. So health camps provide for massive screening. And when you screen, what the data shows is that about 25-30% of those we screen have NCDs that they didn't know they had. Yeah. So the issue here is that when you screen and you find out, then they treat, because when you have NCDs untreated for a long time, the implication burdens the healthcare system. Yeah. Okay, so impact, we've said, in the health camps that we've done at Zuri Health, we've probably seen over 300,000 patients and provided, healthcare to, a continuity of care for those patients for, close to a year. Out of that, we have maybe 25, 30,000 NTD patients that we've seen onboarded on a continuous care program where we're managing and treating them. But the biggest thing around the impact is the life saved, kids delivered, impact in terms of people provided information around healthcare, impact in terms of savings you would have had, because you need to look at, you can't divorce access to health to economic productivity. If I am unwell, then I can't earn, right? And when we intervene in these communities, and you see most of those communities, people live every day hand to mouth. So which means I have to go out earn a living for that day, to be able to feed. And when I am unwell, I am unable to do that. Data has shown actually that in areas where we've had medical camps, that the economic spend in that area increases, right? Essentially, one of our partners that we've been doing medical camps with have seen that there is an increase in the usage of their products and spending, in that area after a medical camp. And what does that show? It shows that you cannot divorce the economy of a particular region or a place from the health situation in that area. So essentially, when we intervene in underserved communities, there is a pickup of economic activities.
Is that part of the research, one area? So how the impact of economic or rather health on economic activities, or is it also just an assessment of the conditions that can be treated? Because you mentioned NCDs, that's non-communicable diseases, building homework. But is that also part of the assessment? And how do you assess the success of a camp?
Okay, so the original plan or the original goal of a medical camp is to alleviate suffering and save lives. However, we're saying that economic success is an aftermath of what you do. So it's one of the impact you see. When, for example, Zuri Health is planning for a camp, we are not saying we want you to earn more, or we are thinking you are sick. Let us help you in this, because you're sick probably because you don't have access and you cannot afford those two things, cost and availability. So when that mobile clinic comes to you, it's coming with equipments probably that are not available. It's coming with medics. Remember, in Kenya, we are saying only 16% of medics are in the rural areas. Majority of us are in Nairobi and these places, right? Why what some of the things that make them to not want to practice in rural areas is availability of, for example, the lab equipments and these screening services. So when the mobile clinic is available, now you can see a pool of specialists. They can even go and offer services in the most remote areas in Kenya. Again, remember, the cost of putting up, for example, a hospital and equipping it is a bit higher. And that hospital is immobile. But now with a medical clinic, today I'll be in Mandera, tomorrow I can go to Ajil. And a mobile clinic infrastructure is better because it's able to move around and even to the remote areas. However, we are saying that when a country is healthy, then it's productive. Okay? And this is what we see after. And it is the aftermath of a medical camp.
Okay. And maybe just to add to that, because we need to look at healthcare, not just from savings, but not just from spend, but savings.
Yes.
So for example, in Kenya today, there are only 5 PET scans for people who have cancer. And all those PET scans are based in Nairobi. Let's look at cancer patients. Everybody knows how extremely expensive and financially damaging a cancer diagnosis can be for a family. Now, you have cancer and you are outside Nairobi. For you to do a PET scan, you have to come all the way to Nairobi, right?
Yeah.
In a country where you have thousands of people with cancer, you have only 5 PET scan machines in Nairobi, and all of them are almost always fully booked.
Yeah.
There are people on the wait list for months.
Yeah.
Now, for a condition like cancer, that's terrible. That's almost a death sentence, right? So the question is, when you look at a mobile clinic, a mobile PET scan, moving from Nairobi and going to Eldoret or Kisumu or all these communities where people have cancer and they can come and do their PET scans. That is moving infrastructure.
Yeah.
Right? So investing in a mobile PET scan clinic can help. That is the essence of a mobile hospital, to move an infrastructure like a PET scan to a location where you can aggregate patients and let them have their PET scans. Now, the cost savings for those patients, transportation, hotel, feeding, whatever, is immense and can aid their treatment. So there's a savings element to that.
Yeah.
And remember that in some of these locations, the distance between where you live and the nearest hospital to do a basic ultrasound could be an hour, 30 minutes. Now, the cost of transportation is also very expensive. So in fact, almost the cost of transportation could be almost the cost of the ultrasound. So imagine a mobile clinic with an ultrasound coming to your location provides an opportunity for people to do that. But also look at people who are, disabled, right? How are they, how should they be able to move to access healthcare? Yeah. So these are the opportunities and the importance of being able to move a hospital from a location to another location using a mobile clinic.
All right. You're listening to the Med Squad podcast. Now, when we come back, you've heard all the noble intentions of the medical camp, but there are some risks. We'll find out what those are when we get back. Hey there! Welcome to Zuri Health HQ, where Africa's finest medical minds meet modern care. I'm Yafesi, your host on the Med Squad.
Hair care is personal. It's not just diagnosis, it's direction. From a cough to managing chronic illness, we listen and we lead.
Every symptom has a story. We listen, explain, and act together.
Nutrition is not just about food. It's fuel, it's healing, it's prevention. We help you eat with purpose, for energy, for recovery, and for lifelong health.
We are not just lab coats, we are detectives, and your blood speaks when we translate.
Your mental health is not a luxury. It's your health, period. Whether it's trauma, depression, anxiety, or even wanting to speak to someone, we are here for you.
At Zuri Health, collaboration is our strongest prescription. We connect expertise across Africa to deliver care that is smart, affordable, and people first.
This is the Med Squad. Real conversations, real health, real people. From your inbox to your bedside, we're with you. Welcome back. This is the Med Squad podcast. And as we talk about mobile clinics and medical camps, there is a communal aspect which has, we've talked about talking about infrastructure, sending, PET scans, mobile PET scans, all this activity going on in the community. And it's also exciting when there's a mobile camp in the area. But is there another aspect to it that we may not be aware of, especially emotional?
Okay, so you already mentioned it. One very important aspect is the emotional aspect. So medical camps are not just about medical intervention. They're also those tear-jerking moments. Humans are emotional beings. They're sensational beings. So aside the papers, aside the medical interventions, you see women shedding tears. You have tear-jerking moments. All of a sudden, there's this woman who's been sick for a long time. She thinks she has malaria. She's treating malaria and taking local concoctions. And she comes for a medical camp and you tell her she has diabetes and that's why she's always weak. She's always sick. And she starts crying. You haven't even treated her yet. So those moments are moments that empower not just the people there. It empowers others, the sponsors, the donors, to keep doing what they are doing. Even the policymakers, the politicians, they see these tear-jerking moments and they're like, oh, this is something good that Zuri Health is doing, then we should key into this, okay? And aside that, beyond the jabs, beyond the medical intervention, there's also, I can't remember the community we went to when I was in Kenya last time. Machakos, yeah, something profound happened. There was a girl who came with, 3 girls came with their uniforms, okay? They came from school. They came without their parents and they heard that this thing was going on in the camp. And we talked to them. One girl was writing her assignment and Mr. Ikechukwu asked her, why are you here? What are you doing? And in the course of the conversation, we realized that she could not pay her fees, okay? And we started a communication with her and, these are the things that happen when you come to a community where beyond what you're bringing, you are noticing or you are identifying other problems like, lack of the wherewithal or the financial capacity to even, continue your education, okay? And beyond that, you see the moments you're hugging. Some people have never been touched by professionals in their lives. I had a video of some young men who they were apparently drunk and, they felt like nobody wanted to associate with them. Mr. Ike associated with them. We hugged them. There were so much smiles. So beyond the medical intervention you're not coming with just health intervention. You're also coming with hope intervention.
Yeah.
So it's beyond help. It's hope that, people remembered us. Doctors who are seen as demigods in white coats, they remembered us. They brought their needles, they brought their coats, and you think that they are worthy of health intervention. And then it just brings us closer to the issue of universal healthcare.
Yeah.
Healthcare is supposed to be for all, whether you don't look good, whether you don't smell good, whether you do not have money to access healthcare.
Yeah.
So these are the problems and these are the impacts that, bringing mobile camps and mobile clinics and medical camps, add. So beyond the, serious things that we think that we're going there to do, just the smiles, the hugs, and just seeing people who you think that you would never see, you would never hug, and they're touching you, they're smiling with you, they're hugging you, they're taking pictures with you.
Yeah.
It gives hope.
It gives hope.
Yeah.
And that's something to aspire to.
Yeah.
But you're adding to the impact
Yes,
or also
yeah.
talking?
So
Okay.
the other aspect of a medical camp is you realize that you go to different locations. And when you get there, you have the opportunity to see a lot of people from the same community, probably sharing the same traditions, cultural beliefs, and even religious beliefs. And from there, you're able to pick some of other problems they could be facing as a result of their traditions. And that is very important because it informs now the health policies and infrastructure around there, because you're able to pick, it's from this kind of behavior that these people are suffering from this kind of a disease. So the cultural aspect, you're able to understand more because you're not seeing one person. You're seeing several people with the same problem, with the same mindset. You give them an opportunity to unlearn things and learn things in terms of their health and their well-being overall.
Okay. So then what are the risks? This is a very noble vision. You want to say, you have hope, you have these outcomes that you want, but what are the inherent risks of medical camps?
There are a lot.
Yes.
And in fact, there was a healthcare professional, a policymaker I was speaking to, and he doesn't like health camps. What he says that health camps are a poster child of inefficient healthcare services. I disagree a little, but I can understand a bit of what he's saying that. Because in most cases, the risks are a lot. So touch and go. You go to a community, you've screened people.
Yes.
You tell this person I have diabetes, you have hypertension, you have cancer, then you leave. What are they supposed to do with it?
Yeah.
Right? They don't have the money. You haven't provided them a pathway to seek health. You've just told them you have diabetes, you have hypertension, you have cancer. So what? Right? Now, the person could have been, living in their blissful ignorance and, been able to manage themselves somehow. But now they know the mental, psychological torture begins. How do I get money to do this? The second one is where there is no connectedness between the local healthcare systems. Right? So I come and I do a medical camp here and I give you X medication. She comes and does a medical camp here and he gives X medication.
Yeah.
Right? What does it do in terms of the healthcare for the person?
Yeah.
And that is why it's always important to connect to local healthcare systems to provide a path to continuity of care. So that if you've seen this person is hypertensive or diabetic, the health records of that community shows that this person was put on X medication. So in case the person needs to go back to the hospital, the health records are there.
Yeah.
These are the important things and some of the dangers. And also the essence of data. People come harvest data and unethical use of data. What do you do with that data?
Yeah.
So how do you ensure that those things are managed? So these are some of the risks involved in that. And the final one is over-dependence on that, because some governments will not do anything around their healthcare because if somebody keeps intervening,
Yes.
right?
Yeah.
So, everybody, the big daddy syndrome, everybody is coming to do your work for you. So because of that, a health camp is going to come. You're not going to invest
Yes.
in providing, healthcare for people in that community.
Okay. Do you have any other risks that you've experienced?
Yes, but I would like to weigh in on something he said. A politician telling you that health camps is a poster child for inefficiency. Inefficiency of who? Inefficiency of the politicians, the policymakers, the government. So they should even be happy that somebody is trying to do their job. And the truth is, from where I come from, I don't know for Kenya, some people even disrupt your work just because it's not them doing it, and they will not do it. So because really, you are really exposing their inefficiencies. So let's keep doing the health camps. And if they feel like, oh, there's something that needs to be done, then they should come and do it, right? So I'll just go over to answering the question. There are three things that, that are the implications of a health camp. One, over-promising, under-delivering, right? All of a sudden, someone who hasn't seen a doctor ever in their life. I've seen, do you know how Zuri Health comes into a location? The fancy buses, the fancy mobile clinic,
walking in slow motion.
And everything, and they're just so overwhelmed and obviously very happy. And all of a sudden, all those paparazzi, all the health intervention, and they're no longer available to continue the work. So there's lack of continuity also. And then also before someone did not know that they had high blood pressure. I believe that it's better that you know that you have high blood pressure and you can't control it than you're living in ignorance. Because just knowing is the first step to even, getting by, right? So even if the doctors are no longer available, you can now start seeking by yourself, seeking medical intervention. It will cost you, but now you know. So the issue of lack of continuity, you come to a location and then you do your test, you do your screening, you make your diagnosis, and then you give them just medication for the now. Okay. There are conditions like high blood pressure, diabetes, chronic illnesses, arthritis that require continuous medication. Okay. So you give them today, who gives them the next day? Right? That's also a problem. Another problem with, another danger of medical camps and mobile clinics is the issue of, I didn't mention, under delivering, right? You come and diagnose someone of a condition that requires surgery. When you're coming to the community, you didn't tell them that they think that you're coming to save them. All of it, like the savior is here. And then you find a hernia, you find a tumor, you find a mass. What next? And then you disappear, right? So it's like a short impact project. But there are some, organizations that do better and they have a way to continue, these interventions. That's like, I think we'll talk about it further down so that we don't. Exactly. But that's really a problem because you don't come to me and give me the soft life and give me the good life and all of a sudden you're gone. It's a problem. And then it makes them feel like, okay, the next time another organization comes and there is this apprehensive behavior. Oh, they're here again to use us for PR.
They've been hurt before. So
they're here to use us for PR and optics because the cameras are always there. I don't have a problem with the cameras because if you do not document, it never happened. And if you do not document and showcase your work, you won't get more support, you won't get more collaborations, you won't get, more partnerships. So, but you've come here twice, you've come here 3 times, a different organization, you see that the participation starts reducing because you're here for the PR and the pictures again, and to just come and give me a little bit of, the good life, and then you disappear. What happens to me next? So that's a big problem.
Yes. So on the same, I want to also attack that inflammatory politician.
Yes.
Let's call them out. With the biggest economies, do you want to tell me they don't have medical outreaches? They still have. For that person who has a poor health-seeking behavior, they don't want to go to the hospital. They have a phobia, probably lost somebody in a hospital before, and they don't want to go. But when you come closer to them, then they are there. Think about a community where you've been walking around all hospitals because there is no available service. Today, you've seen people who are able to tell you, now this is your problem. You have something to start with. You have a diagnosis. Yes, you don't know what to do next, but at least you know what is ailing you. You see, there are those people without a diagnosis. They've been walking around. They don't know what to do. Yes, I'm not giving you more after the diagnosis, yes, but at least now you know where the problem is. So that is the brighter side in the medical camp. So, however, on the risks, so all medical camps, you're thinking about bringing a congregation of people with different kind of conditions. It is not a controlled environment like a hospital where you can say, hey, you have a communicable disease, very infectious, you should be secluded or you should be quarantined. You don't have that. So there is likelihood of transmission of other diseases, especially in children, pregnant women, and people who are already immunosuppressed, high-risk people in a camp. So that's one. The other aspect is the biohazards. You see, people come, there are sputums, there's blood, and sometimes some camps are not properly set up, and biohazard is a really big thing that can impact a community even after you leave. However, on the same issues about continuity of care, as Zuri Health we have, is a telehealth company where now technology also offers a gap. It fills that gap of continuity of care. After we leave you and we give a new medication, we can still follow you up through telemedicine. So I think that is coming up so good. So when you combine telemedicine and medical camp, now you have a fully fledged working, very well-oiled machine to make sure that you can follow up patients.
Is there a risk of one camp being set up differently from another camp? Like this one has a better environment, this one there was this missing, or there was this challenge to get certain equipment there, or are they all standardized? You don't move until you have certain boxes that you've taken.
So for us at Zuri Health, we don't move until we have certain boxes ticked. We have a standard SOP that guides our medical camps and where we go, including security, etc. So these are very important SOPs that you build to have. So from that point of view, is de-risked, right? So the standard that we'll have in YG is the same standard we're going to have in Lamu, same standard we're going to have in Nairobi, same standard that we're going to have in Lagos or Oposi or Uburu, whatever. We're going to have same standard.
Okay,
sorry. This brings us back to the policymakers and the government.
Yes.
It is, the onus is on them to standardize medical camps, right? Because what we see in Nigeria, I don't know what happens here. Someone can just wake up from somewhere and you're in a community and you're doing medical outreach. There isn't, because people are more excited with the fact that you're bringing something free.
Yeah.
So some people can come with fake medications. Some people can come with non-qualified medical practitioners, or people who are not even medical practitioners at all. Okay, so it is a good thing that Zuri Health has made it a duty to always bring standard, medical camps. But we can't say the same with, just well-meaning Nigerians, well-meaning Kenyans, well-meaning Africans who just feel like, oh, I want to do something for my community. And they just call one of their friends, oh, please buy me drugs from here, buy me drugs from Aba, buy me drugs from one market. And okay, please, did you have medical students, you have doctors, and they just put together, a medical team that has not gone through any standard scrutiny. Nobody knows. You just come to a community and you're wearing as long as you're wearing a what coat, people will look at you like you know what you're doing. No. So we need standardization.
Yes.
From
policymakers,
from the Ministry of Health. They shouldn't just leave it, it's something that organizations and private persons are doing. They should not just detach themselves from what is happening. So it's your business, Mr. Politician. You should be involved. You should be happy that people are coming with this. And then also you should be ashamed that people are coming to solve a problem, a basic problem that you are supposed to have solved. Yes. Okay, football matches are good. Buying wrappers for the women in the village and buying jerseys for the community footballers and buying keke and bona, they're all good. But someone who hasn't had good health care, somebody who has never, somebody who doesn't even know their vitals, somebody that is not healthy, how does the person, use this infrastructure or use these gifts that he has brought to them?
Yeah.
Dead bodies don't drive bonas, right?
Yeah.
They don't.
So I have to add something.
Yeah.
So because of the gaps we have in the policy and standardization, as I've talked about, Zuri Health, we try and liaise with the local authorities, the counties. We are getting medics from them because we know they work in their hospitals, so they are qualified.
Yeah.
Okay. We liaise again in making up these services that we are offering to make sure that we don't overpromise so that we're able to provide the services. Remember, if you're offering a free service, then you are limited by the budget and how much you're willing to spend on that, okay? So in terms of making sure that the medical camp is impactful and effective, then you need to liaise with the right people. And that is the county, so that you make sure there is safety and effectiveness of your camp.
Yeah.
Well, when we get back, first of all, Mr. Politician, stop looking out the window at the camp. Look in the mirror.
Exactly.
There. Hey, that's just from the experts. But when you come back, we'll be talking about actually doing it the right way. Stick around. This is the Med Squad podcast. Welcome back to the Med Squad podcast. And I should have done that in slow motion, like the Med Squad when they arrive for their medical camp and remove the sunglasses. But I was talking about doing things the right way. So the aim here with the medical camps is to truly serve. Okay. And so how do we do this? We've mentioned free camps, the word free. Once Africans have a radar for the word free. So you just latch onto that. But is it really free? Like, what is the cost and what does it take to actually put up a medical camp?
No, it's free to the recipients.
Yes.
But somebody bankrolls it.
Mm-hmm.
Somebody pays for it.
Yes.
So, the cost varies depending on the scope of, the camp, and what's the services that you're going to offer during the camp. So the cost varies. However, one of the things that we do, at Zuri Health is to ensure that we have very close collaborations with the health community. So we call it co-creation.
Mm.
We co-create with them the best scenarios.
Yes.
So co-creation means ministries of health. Health is a devolved function, right? In Kenya and also in Nigeria, right? So which means that the sub-national governments, which are the counties and the states, depending on the word, how you pronounce it, how you describe it in your own country, states in Nigeria, counties in Kenya, that the subnational governments have, control over access to health. So we speak to them, we liaise with them, we plan out.
Yeah.
In fact, they help us in choosing the location where they think that the health burden is higher and where we should intervene in. And after the camp, we're able to share information to say, these are data. This is what the data speaks about access health here. And if you're building policies, this is where you should probably focus on in doing that. Then the other very important one is when you are transparent about your process, right? Then it becomes the norm. So for example, wherever you want to go do a medical camp in Kenya today, they'll say, will you do it the way Zuri Health does it? And I feel proud about that because we've set a standard that, and that standard is governed by a lot of strong, SOPs that we've built over time, co-created over time with each of these subnational governments and the national government, that people are now forced to work within that well-defined framework. And our hope is, as we begin to push health camps, mobile clinic as what we'll call a standard process of health screening and an important partner in preventative healthcare, we now begin to see how we can push for policies that streamlines this process. That says, before you do this, you must have 1, 2, 3, 4, 5 checklists approved. And then, we're looking for, then I would encourage more of it because it will be something that will be game changing towards, our quest to providing access to healthcare.
Mm-hmm. Now, obviously, in African context, the term transparency, where costs are involved, where money and equipment is involved. How do we deal with that as we deal with medical camps? We've already addressed Mr. Politician, who is looking at us with side eye. But so, in the issue of transparency, knowing that the cost there's a base cost that you can't do without. So how do we address that going forward?
Okay, so first of all, you talked about it being free. There's always a sugar daddy in healthcare, right? Mm-hmm. In anything, there has to be a sugar daddy. So if you're not paying for it, there's someone else paying for it. And I think that we need to stop, treating healthcare like it's charity. Healthcare is not charity. it's a service that somehow has to be paid for. The doctors will have to be paid, except they're just offering their services for free. But if you're organizing a health camp, the doctors have to be paid, the lab scientists have to be paid, everybody has to be paid. The cameraman, the cleaners, somebody has to be paid. So whoever is organizing a health camp, because they know that there's money involved in the planning, in the standard, the SOPs that have to be delivered. I'll just use Zuri Health's, standard, right? They have to remember that they don't just wake up one day and decide to have a health camp.
Yeah.
So if they need to have a health camp, they need to get approval from, not just from the local level, because from the local level, it can be, we do some kind of, I know you know me, just come in. Maybe not from the highest, but from a level where all those checklists would have to be done, right? And then you know that if I do not have the money, if I cannot raise the money to have this health camp the way it should be done, then I shouldn't do it. That's transparency.
Yeah.
Transparent enough to know that you cannot do a health camp just because you want to do it.
Yes.
Okay. And then that also takes us to data collection and privacy. From where I come from, right? There's a lot of times sometimes we do, please cut that off so that I'm not calling out Nigeria, right? So some people go for health camps, no registration, no records. They do not even get the participants to sign anything. The Machakos, am I correct? Yes. Machakos. Everybody had to sign something.
Yeah.
They had to sign, okay, doing this, they have consent to do this, and then I gave consent to participate in this.
Yes.
It has to be a thing. It also helps with data collection. Now, what do you do with the data? Some people don't even collect data, so they don't even use it for anything.
Yeah.
So, but it's good when you collect data, and then if you already have, if you have collaborated with the right authorities, you can now take that data to the Ministry of Health, and it can be used, to know, okay, this community, this is the kind of infection they usually have. This community, they have the illnesses they suffer from is as a result of lack of wash facilities.
Yeah.
So they need water, they need sanitation. This community, they have a lot of malaria infestation, so they need malaria, insecticide-treated malaria nets. They need, then this is intervention they need, so that when another person is going there, you can tell them, you come to the Ministry of Health, you say, I'm going to Oposi. They inform you that in Oposi, based on the intervention or based on the data that Zuri Health has brought from their last medical camp, this is what Oposi community suffers from. So you don't go with medications for let's say, for arthritis. When there's a problem with the food that they take, we have salt. We have a salt lake there. So there's a high level of ingestion of deionized salt. Okay, they have problems with thyroids. So if you go through it the right way, if you're transparent enough to go through it the right way, the Ministry of Health will inform you that, okay, when you're going to this community, go with this sort of interventions. If not, you're just going there and going with whatever you want.
Vibes.
And then somebody needs a shoe and you're giving them a jacket.
Yeah.
You have not solved the problem.
Yes. Okay. So,
yes, I mean,
yes.
Like I usually trigger you to say something.
I see that's mine.
So, okay, in terms of transparency of costs. So, the one who bears the cost is the one planning the camp, okay?
Yeah.
Be it sponsors or if somebody is bearing the cost. So, the end user or any other person is concerned about the quality of the service you're offering. While we have infinite diseases, we have unlimited budget of whoever is proposing to do a medical camp. So I think you only bite what you can chew.
Yeah.
If you can, this is what you can afford, then you ask yourself, at this budget, what services can I give comfortably to the best of the required standards? And then that is what you do.
Yeah.
So we cannot say that we have a specific base of how much you should offer, because it's service dependent. It has to correspond with the services you're offering and all these factors. So a medical camp is a well-planned thing. You just don't wake up and think you're going to just do 1, 2, 3, 4.
Yeah.
Because you need to be impactful and purposeful.
Okay. All right. As we conclude, just like what if you had one sentence you could say to either the government, the recipients of the medical camp, or partners, what one sentence would that be? So you select which one you're speaking to.
Healthcare is a fundamental human right. Everybody deserves access to affordable, accessible healthcare. Health camps and mobile clinic have come to stay.
Okay, I would just say that healthcare, especially mobile clinics medical camps and mobile clinics, they should be an integral part of the primary healthcare system.
Yeah.
It shouldn't be something, it should be permanent. It shouldn't be something that is coming from outside of the existing, health infrastructure.
Yeah.
Because it's solving a lot of problems. For politicians, think about medical camps and mobile clinics as something basic that can solve a huge problem that you do not want to bring out big money for. Engage, organizations like Zuri Health and any other organization that offers these services at a standardized level, and make it your constituency project. Healthcare is basic. It is humanity. Everybody deserves humanity. Everybody deserves healthcare and dignity. So politicians, I'm here for you. Make this a permanent thing. For places where you have immigrants, crisis areas, it can be a game changer.
Yeah.
So stop building hospitals, please. A politician comes and say, I have built what's the word they use? A high level. We don't need high level. Please just leave that for the private organization. Please, I'm very angry. Private organizations that can handle it. You are short impact people. You know that you're here for 2 years, 4 years. Leave that for people who are businessmen and who have the technical know-how to do it. And just do basic things like medical camps and health camps. Make it your constituency project, and don't do it yourself. Reach out to organizations that are already doing it, and facilitate them, fund them to do it. We are not competing.
Yes.
The end user, the end beneficiary is the patient. It is your people, the people who vote for you. So think about them and do right by them. Thank you.
Antony,
It's heated up.
Antony, your one sentence has a lot of pressure on it right now.
So for me, I think that medical camp and mobile clinics, they are reinforcement. They enrich and they already stretched the medical infrastructure we have, and that investing more on those alleviates more pressure on the people. Think of those diseases that do not need long-term follow-up. You just treat them and they're okay, they're good, right? So it is the future, and incorporated with telehealth. And I think that is the future. Yeah, I'm so passionate about it.
Oh, yes. Yeah, this has been the Med Squad podcast. Of course, anything you had on this that you feel you need to share, especially with those people who just brush aside medical camps and just be like, yeah, I've seen it. This is the real impact. So part of the impact is you sharing this episode with them and following us on all our platforms at the Med Squad Pod. We'll see you next time.